Brian Heaberlin here with Lexington ENT and Allergy, and I'm going to talk about hearing loss today. This is a huge topic, so I'm going to kind of skim over some important things that I think people would want to know about hearing loss. So broadly speaking, there are two types of hearing loss. There is the common type, which is sensory neural hearing loss, which is where inside the cochlea of the inner ear, the hair cells that detect sound waves don't work. Those hair cells, it can also be the nerve of hearing, but it's most commonly the hair cells don't work well. And that's often related to three factors, the three big ones being age, noise, and family history. And so many times it's an interplay between those three things that causes people to have the bulk of hearing loss. Another type of hearing loss is what's called conductive hearing loss, and that means sound waves don't get down to the cochlea. So that can be a problem such as earwax in the external ear canal. It can be a problem with the way the eardrum or the little bones behind the eardrum vibrate. There's sometimes fusion of the last of those bones to the cochlea and a condition called otosclerosis that can cause a conductive hearing loss. Sometimes it can be fluid under the eardrum or a hole in the eardrum, which provides less eardrum surface to vibrate. So those are all some common reasons people can have a conductive hearing loss. And then there's, I guess, a mixed hearing loss is kind of when there's a combination. You've got both a sensory neural part and a conductive component to it. And so that's a broad overview of some of the general types of hearing loss. To help prevent noise-induced hearing loss or the sensory neural type hearing loss, we would really love for people to wear ear protection when they're doing anything that's very loud. That's the main thing. You can't keep from getting older and you can't stop your genetics, but you can try to reduce the noise trauma that causes damage to those hair cells. That's a cumulative problem. So people that shot guns during their teenage years may not notice problems at that time, but now when they get to be 60 or 70 and they've been working in factories, and all these things kind of add together to create hearing loss. Hearing loss is very treatable. All these types of hearing loss is very treatable. For the conductive hearing loss, sometimes we can try to fix the problem. Certainly it can be as easy as taking out some wax or draining, putting an ear tube in, or doing something to drain the fluid. There's surgeries to relieve that bone fixation that I mentioned a minute ago. So there are some surgical or office-based treatments for some types of conductive hearing loss. For sensory neural hearing loss, we're mostly dealing with hearing aids. For some extreme cases of sensory neural hearing loss, there's a procedure called a cochlear implant that can directly bypass those damaged hair cells and stimulate the nerve directly as a way to provide hearing to people that are basically deaf in that ear. So there's a lot of great things out there with hearing loss. Many people with hearing loss will have tinnitus, which is a ringing in the ear, and I've done another video on that you can find. So yes, hearing loss is a big problem. People have huge issues with it, and so if you know of someone or you have hearing loss yourself, they really should get checked out with a good hearing test and a medical evaluation to make sure they don't have something correctable with their hearing loss. We're happy to help here at Lexington ENT and Allergy. We've got a fantastic and comprehensive audiology staff and all the latest equipment to take care of these issues. So thank you.